what I do after the class is I upload these to YouTube, and then I'll post them on our site, so you can go back and look at them. Okay, I know that helps with not having to take notes. I will also post the PowerPoint slides on there for you. Okay, I think that really helps with that. Oops.
Next time, can we post the PowerPoint beforehand so we can like take notes while we're doing it on the PowerPoint?
I will do that.
Thank you.
I will do that, Devin. No problem. Okay. Okay, so I'll go back to my PowerPoint slide. Thank you for all the people that were willing to change between the two classes. And I know that I know it's frustrating. And I said, I think right from the very beginning that I might not be able to do that. Can you see my PowerPoint slide or no? Are you just seeing other people? All right, let me try this again.
We saw the slides.
Okay, all right, there we go. Okay, so here is the groups as they stand right now. And so thank you for the people that have already decided that they could go from Monday to Friday. I figured Monday was going to be more popular than Friday. Who wants to do anything on Friday, right? Remember, this isn't every week. These are only the weeks that we meet face to face. I need one more person to move over. So I'm not going to ask for volunteers right now. What I say is that think about it. If you can move from Monday to Friday, if I don't hear anything by tomorrow morning, I'm going to have to randomly draw a name and move somebody to the next one. Okay. All right. And I will post this on Facebook on Blackboard once we're done. Okay. All right. So what happened with COVID this week? Let's start there. It seems like there's something happening every week with COVID. We just get our guidelines down pat in our own brains, and the CDC or the World Health Organization come out with something different. And so this is what I would expect if you were doing a weekly report on COVID, if that's what you're assigned, to just give us 3 to 5 minutes of what's going on with COVID. So this week, a couple of days ago, actually, the CDC changed their guidelines on who should get tested. And it was met with a lot of resistance. Some news agencies said they came out with it really quietly. They didn't make a big announcement about it. And many of the news agencies want to link it to politics, particularly to the president. And so what we always want to do whenever we have something that comes out like this, we always want to go to the source. And so that would mean that you would actually go to CDC and actually see what they are saying about it. And so this is what actually the CDC said. I pulled this, just a screenshot from a news agency. But then down here, actually, you'll see this on the PowerPoint slides. When you can go into it, you'll see what the testing update is for the CDC. And so here it is. It's really got the summary of what's going on, why it's happening. All of this is very, very good information if you're working in a community health setting, or if you're really looked to by your friends and neighbors and peers to be the expert in what's going on in medicine, as many of you will be as nurses. They come to you and say, well, what do you think about this? And you're just like, well, I didn't even think about that yet. Let me do a little research. Always go to authoritative sources. And so the CDC is considered an authoritative source on this. Agree or disagree with them, they are a bunch of brilliant people working together to try to solve infectious disease problems. And so you can always go to the CDC site and then be able to research what's going on. So that's what happened with COVID this week. We had a new announcement, new guidelines that if you're asymptomatic, they are recommending that you possibly don't need to be able to be tested if you're asymptomatic, even if you've been exposed. That's different than what's been done before. So we'll see where this goes. It could change by next week. Who knows? So that's kind of what I'm expecting from you when you're just giving an update to the class. Any questions on what happened this week with that? How many of you are actually working in healthcare right now? So are you seeing, several of you, very good. So are you seeing COVID patients still? Yeah. Yeah, it's still a concern for healthcare. I think it's kind of old. People are getting tired of it, so it's kind of old news. They don't really pay attention to it. but it is still out there and still a real concern. All right, I'll go back. I know, I hate it. I'll try not to go back and forth between my PowerPoint and the class shot because I know that's frustrating for you. Okay. All right, so, and this was, if you were doing a weekly report on a community health role, this is the kind of thing that I would expect you to look for. So I actually found one that is not considered a nursing, quote unquote, nursing role. It is, although a nurse could do it, they're pretty open on who they have, but this is for the community health role in population health specialist for outreach community health centers in Milwaukee. They had this posted on Indeed. It talks about what actually would be the job purpose and then the education that's required. And so I thought it was really interesting, and under the job purpose, it says the specialist uses population health strategies to address the preventative, that's something that population health nurses do, prevention, and chronic care needs of a patient population. This includes analysis of data, which we community health nurses do a lot of, analysis of data to identify care gaps, outreach to patient to help them obtain needed services. So access to care is a big concern for community health nurses, and collaborating with clinic staff to ensure care coordination. And then under experience, it says requires a bachelor's degree in public health, social work, or a health-related field, which is actually what you will have. And then it talks on the right-hand side about all the different job functions. And so many of those are really align well with community health. So this was just a type of role that you could do if you were a nurse and you wanted to work in community health. Okay, so what is public health? Obviously, public health, the American Public Health Association is another authoritative source for public health information. And public health really looks at what are the health needs of an entire community. And it might not be a neighborhood. It could be a community such as the elderly. It could be a community such as those with heart conditions. It could be a community such as those with mental illness. It could be a community such as those who are vulnerable to violent crimes. That's the population that I see. So when you're working in community health, you're looking at these populations and they have a shared characteristic or something that is going to show that they indeed can benefit from some interventions to an entire group. It's going to help the health of those individuals that are in it. And so here's some things that we do. I took this from the CDC website. This MMWR is a mortality and morbidity report that they put out weekly. That's what those stand for, Mortality, Morbidity Weekly Report, MMWR. And so they have a lot of information they post on the CDC website. This is one of them, this weekly report. And so in 1999, they posted this. It was talking about the greatest achievements over the last 100 years in public health in the United States. And so you can see on there some of those things that I think maybe you wouldn't think fall under nursing, but they really, really do. Just being advocates for that population, making sure things are good for them. And so, you know, recognition of tobacco that happened in, as a health hazard that happened in the 60s. Control of infectious diseases we're still in the midst of, right, with COVID. Safer workplaces, occupational health nurses are involved in that. So this is just an idea, just an overview for you so you understand what's going on and the kind of things that we really look at that affect communities. So what is an aggregate? So this is one aggregate that you can see here. These are students returning to school this fall. So it really looks at a population that has a common characteristic. So for example, for these students, we might be looking at their health needs from many different angles. About 2/3 of you are actually in school nursing right now as your clinical, or at least going to start there. We are in the Mequon-Thiensville School District and we are in the Lumen School District. And so you will meet students through that. You'll be doing health education, but you'll also be addressing some of these things, like how do we protect those little kids from COVID this fall? What do we actually do? How do we keep them safe in an environment if they have nut allergies. That's a big thing for school nurses right now. What if there's a nut allergy for a particular student because the other students, they don't understand? You can educate them on not bringing things. And there was one of the school nurses was relaying to me last year, one of the students had a nut allergy, and some of the other students, this was 2nd grade, so think of how young those children are. And the other students would be throwing nuts at them. I mean, they had no idea what that actually entailed and how dangerous it was. So how do we keep them safe? What do we do to protect them from sexually transmitted infections as they get older, as they're in middle school and high school? It's hard to believe some of these students are having sexual encounters so early. And how do we prepare them so that they're not exposed and not do it too early? It's really a challenge to try to figure that out. What do we do about teenage pregnancy? Is there anything we can do about that? What if their environment isn't safe at school? We'll talk a little bit later in the semester about a situation where there's a playground in a school and it is right next to the major highway. I mean, like the kids could throw their pencil and hit a car. That's how close it is. And so when you look at that, now the kids are outside, they're playing in recess, you've got all these exhaust fumes, and now what do you have? A higher incident of asthma with that population. How do we protect them from that? And then what could we do about bullying or gang activity, which unfortunately is growing in some of our areas? So you might have an aggregate like this, but you also might have an aggregate like the workplace. You could, like I said, you could be an occupational health nurse. You might have an aggregate that's inmates, and you're a correctional facilities nurse. That's a community health nurse as well. So it is always looking at this entire population, how we can make them better. So we'll talk, I think you'll have some reading or some visiting of sites next week in your activity of Healthy People 2020, which is what the federal government has put together for our goals to be able to move forward and have a healthier population. We're not the healthiest population. The United States is not the healthiest population in the world. We really lag. And so that is one of the ones that we are where the goals are that we can look at. And now they are developing 2030. You would think it's 2020, so they should have developed 2030 a while ago, but they were actually working on it. That's the timeline that's right now, and we'll talk about that also. So this is a good diagram, and it'll be one that I think you want to highlight when you get the PowerPoint slides. So this is one. First of all, on the left-hand side of this diagram, you actually have what we call the social determinants of health, or this one calls it determinants of health. This is how we look at any challenge or issue or problem that we see as a health risk, and we identify the different areas that are leading to that being a health risk for that population. These are the determinants. That means it's the things that determine those health risks. And so you'll see there's 6 of them. Sometimes you'll see a chart that may have added more, but these are the basic 6. And so they talk with what biologically is this with that person. So that person might be predisposed to a particular disease, or they might have been born with a particular malady that makes them more susceptible to something. Psychologically, do they have any mental health issues? Are they under a lot of stress? Right now, all of you are under a lot of stress because of having to attend school with this COVID pandemic hanging over our head. It's not the same as it has been before. So that could lead you to having more risk for certain health conditions. Environmental, I talked a little bit about that already. Social cultural, are you under the poverty level, or do you have the ability to pay for things? Do you have access to good food? Or do you live in a food desert and you can't get any good foods other than fast food, which is cheap but not healthy? Behavioral, what behaviors is somebody exhibiting? Do they smoke? That's a behavior that would negatively impact somebody's health. And then health system, a lot of times we were talking about access to health. So the doctor's office can say, you know what, we are open Monday through Friday, 9 o'clock to 4, by appointment, and so that's it. And what we learn is that a lot of people can't make those doctor's appointments. Or they may have come from a culture that if you have an appointment, as long as you show up within an hour of that scheduled time, you'll get seen. And so access to healthcare can be a big issue, and we will talk about that too. Then in the middle of this, it talks about what are our interventions that we can do. And the top one you see is education. Everybody knows that. Let's educate, let's educate, let's educate. But there are many, many other things that public health nurses do. On the bottom, you'll see levels of health care. And so I'll say that, health promotion, that's going out and saying, hey, everybody, you might be susceptible to high blood pressure if you have these signs and symptoms. And so we're going to educate everyone. We put like signs on billboards, or we might be putting signs on buses, those kind of things. That's health promotion. You might be working a lot with prevention. Prevention means that we go ahead and we target certain populations and say they are really at a risk for XYZ, and we're going to help to prevent that. Resolution is about if someone has something, how do we get them better? And a lot of that has to do with screening. So we might be screening a population for diabetes. I might have diabetes and not know it, adult onset diabetes, right? So my doctor screens me for it. Well, there's a lot of times a community health nurse will screen an entire population, a drop-in clinic kind of thing. Come on, go ahead and drop in, and we'll do your blood pressure screening, and we'll also do a diabetes screening for you. And then restoration is helping people live with chronic diseases, living their best life with chronic diseases. We'll talk more about these. Then on the right-hand side, it talks about, just like the nursing process, we're going to evaluate what we did and see if it really worked. And if it didn't work, we're going to change what we did to try to get better results. So if we took those social determinants of health and we looked at the problem of obesity in university population, this is what it would look like. So it would look like, what are we looking for? Biological, psychological, environmental factors, social cultural determinants. That's what we're dealing with right now, social isolation. Some of you will be involved in a clinical that has to do with our senior population. How can we keep them from being socially distanced? I'm here right now, and upstairs in my living room is my 92-year-old mother, because she lives alone, and all of us kids, there's 5 of us, we tend to take some time each month and have her come and stay with us. She wants to live alone, but she also needs social interaction. So she comes and hangs out with us for a week. But a lot of seniors don't get to do that. A lot of seniors don't get any interaction with people. So this is how that would break down. You would look at those different areas and you would say, how do those social determinants of health apply to this population? So if we were looking at the university population, students like yourself, how does this apply to it? And we might even do this in the context of COVID-19, like for this fall. Again, this is just an overview. We're gonna cover these things in more depth as we go through. So let's look at kind of the history of public health nursing. It used to be called district nursing in the United Kingdom. That's kind of where it started with Florence Nightingale. She started it. So if you hear the word district nursing, that's really from her. But population health nursing has been around for a long time. So really, for a long time, we've had various cultural groups take care of the sick within their communities. It's only been over the last couple hundred years that we've actually institutionalized it, where we had people going to the hospital when they were sick. A lot of times you were taken care of by your family members and that. And the rise of Christianity really helped to define us being accountable for the care of sick. Before then, before Christianity took hold, the sick were sometimes, they were isolated. Think of the lepers, right? They didn't know what was going on with them. They knew it was contagious, so they would isolate them onto islands or outside of the village in order to make sure that everybody else didn't get sick, but nobody really cared for them. And so it was really Christianity that was saying, go out and take care of those who are sick, not just the strong, but also the sick need to have compassion and care. And so, and it's interesting that last term, remember I told you I got rid of the textbook. Last term, I was using the textbook. It was a secular textbook. It wasn't a Christian textbook, but this is what they had in there, that it was really the rise of Christianity really helped that. I had heard that before, but I had read it in Christian textbooks, but this was in not non-Christian, a secular textbook. So pretty interesting. So we'll jump forward from that, and we'll look at the discovery of the New World. You know, a lot has been happening right now around our country with argument over Christopher Columbus coming and the poor Native Americans who ended up being desolated because of it. But we desolated them in another way when we came over from Europe. I say that because I'm of European descendants too. But when we came over from to the New World, we brought with us smallpox and measles. And smallpox, which is this little child, I don't know if it's a boy or a girl, in the upper left-hand corner of your slide, that little child is covered with smallpox. Now, thankfully, smallpox has been eradicated from the world. A horrible, horrible, very contagious disease. But the Native Americans were devastated by that. The upper right-hand corner of the picture is measles. That was still pretty common when I was a child. So within my lifetime, as well as mumps. People were quarantined in their homes for mumps and for measles when I was a child. But what did we get from it in Europe? I'll say we in Europe. We got tobacco. Tobacco was only introduced to Europe after we had come to the New World. And so we brought tobacco back, and all the health risks then that happen with tobacco that are still pretty rampant nowadays. And I talked about this. I'm not interested that you know these names. Don't worry about it. Just know that Florence Nightingale started the term district nursing. Sometimes that pops up on certain tests. If you watch Call the Midwife at all, that is a very good illustration. It's historically pretty accurate, a good illustration of district nursing or community health nursing. The midwives actually go out into the people's homes. They recognize other issues such as a TB outbreak or someone who's got maybe even like shingles and things like that. They recognize those things in the community, and they try to help make that community a better and safer and healthier place. You will watch a video either this week or next week. It might have been this week on Lillian Ward and the Henry Street Settlement in New York. Settlement houses used to be where community health nurses would get together and they would say, you know what, the best way for us to help the immigrants who are coming over from Europe and other places that are living in really destitute housing, and they have a high incident of infant mortality and childhood diseases, childhood mortality, is to get into their neighborhoods and understand their culture and have them trust us so that we can impact their decisions on healthcare. So they actually then settled into these homes within the community, and then they would bring people to these community settings. So they might bring them in for an immunization clinic. They might bring them in for learning how to sanitize baby bottles so that children weren't dying of bacterial infections. They may bring them in for exercise classes. They may bring them in for being able to understand how to cook healthy meals or child rearing techniques. I had some semblance of this when I worked as a public health nurse in a free clinic that also had a maternity house attached to it, where we would have our young mothers also attend classes to learn about different things. Many times they did not have the best role models, and so it was not unusual to see some situations that were, I think, what many people would consider appalling, but it was the way that they had grown up. And so I will read a short story to you next week that will kind of illustrate that a little bit. But that's what the settlement houses were about. So this is just a quick table. It looks at the different things at international events. You'll see here in 1977, smallpox eradicated worldwide. Wow. Wow, wow, wow. 1977, that was huge. Now, the only time you might still see smallpox is if it was ever used as in bioterrorism, just because it's been eradicated as far as infecting the population worldwide, there are some labs in the world that still have this in their labs. And so there has been speculation that because none of us probably have, pretty soon, none of us will have natural immunity to this. I think after 1977, they didn't inoculate you after that. I received inoculation for it, but at a certain point, people won't have immunities that they could use that for bioterrorism if they wanted to. So that's scary. But we'll talk about bioterrorism when we get into our emergency disaster section. All right. Another one here, 1988, the World Health Organization, when you see WHO, that's the World Health Organization, set a goal for eradicating polio, a very, very debilitating disease that affects children mainly, and causes them to not be able to breathe, not to be able to walk. It attacks their musculoskeletal system. The reason that's important is you remember that 1988, and then you jump down here and you say 2002, Europe has been eradicated of polio. And that's pretty amazing. And then just this week, I don't know if you read about this, you've probably been very busy with school. This week, Africa was eradicated of polio. It gives me goosebumps. It's fantastic. The reason the word wild is in here, I'll give you just a brief little history. There are 3 different strands of polio naturally. We've eradicated 2 of them worldwide. They're gone. We have eradicated, this means they eradicated the 3rd natural polio virus in Africa. The only 2 countries that still have it are Afghanistan and Pakistan. And so we need to eradicate them there. There is still some polio, though, outside of this. So there is still some polio in Africa. And that was because the first generation of the vaccine caused an outbreak. They didn't know enough back then when they did that, and so it actually caused an outbreak. So what we're talking about is eradicating wild polio, or those that occur naturally in the environment, and then we will work on, or they are working on, but hopefully we'll get those that were from that first generation vaccine under control. All right, so achievements, you can see some things in here. This one I just showed you is definitely one. Vaccine preventable diseases is huge. Child mortality is huge. Decrease of 2 million deaths in children under age 5, from 77 to 62 per 1,000 live births. We'll talk later in the semester about how we calculate these numbers. And it's not really rocket science. It's not really that hard. But you need to talk about mortality, morbidity numbers, susceptibility numbers, prevalence numbers. You just need to be able to kind of talk those terms in our talk community health. We'll go over those later. We actually have a unit that we actually devote to metrics. So by the time we get there, it'll be good. And then here are some of the achievements as well. You look at TB control, and the reason we've had an increase in TB is really because of worldwide travel again, but now that nobody's traveling, it might be okay for a while. Road safety, that's another thing you wouldn't think about nurses being involved in, but we are. And so these are kind of, I'm gonna stop sharing. These are the things that public health nurses spend their time worrying about. It's the outbreaks, it's the how can I reduce risk, it's the how can I prevent something, let's say a vaccine that's come out. Right now, I was just contacted this morning from the public health department in Washington, Osakie County. They have one combined public health department. And I was just contacted this morning about a preparation for when we have a COVID-19 vaccine, how we're going to prepare for that. Can we include the junior and senior level student nurses here in helping to provide a vaccine clinic? So we'll be talking about that and whether or not you guys can be involved in that, which will be something you can tell your grandkids about, that you were on the front line when COVID came out and the front line of the vaccine. So any questions on anything that we've gone over? I'm going to look at the chat and make sure that I didn't miss anything. Okay. Did I hit record? Am I recording? I am recording. Yeah, thank you. Okay. Anything else? I can't see any of your lovely faces. I can't wait to see you, even if I can only see your eyes next week. I can't wait to see you in class. Okay. All right, so we've got a few minutes here, and what we're going to do, let me share my screen again. I'm going to show you this. Okay, so we know that Hurricane Laura hit this week, and it hit down in Louisiana, and it was going to, my brother has a home in Galveston, which is a little island down there, and so he's still waiting to hear how his home is. But it hit, and I really want to kind of get you in the mindset of community health and what public health nurses look at. So one of the things we look at is disaster planning. So if you go to Blackboard, and I'm going to pull it up right here for you. Under week 1, and you really probably only need one person in your group to be able to pull this up. Right here under week 1, you'll see update class activity sheet for Friday's breakout group. Okay. So here's your kind of your scenario. Hurricane Laura hit the Louisiana coast yesterday as a Category 4. They were predicted winds of up to 150 miles an hour and storm surges as high as 20 feet, although they didn't really get to 20 feet. We'll use that to explore an aspect of public health nursing, emergency preparedness, and response, which is actually a part of public health nursing that a lot of the students enjoy. So let's say it's 3 days before Hurricane Laura is expected to hit the US, and it's currently a Category 3. It's unclear whether it's going to strengthen or weaken as it nears the Gulf Coast. Just a couple of days ago, Hurricane Marco fizzled out, if you remember. Remember, there were 2 that were coming, and then 1 fizzled out. You're a member of a community group that's actually looking at what you're going to do for emergency shelters. And you have closed these shelters recently due to the pandemic, but now you're faced with a different situation because you have some people that are actually going to need some sheltering. You know from past experiences that some residents will not or cannot evacuate, even if mandated or ordered to do so. So that's exactly what they were facing in those areas. People were mandated to evacuate, and I think there were, last count, there were 150 people that refused to leave. The challenge is that it puts the first responders' lives in danger if they have to go and rescue those people. So they were very open and honest on saying the wind gusts have to be below 35 miles an hour before we can send out first responders to come and get you, if indeed you get stranded. So, and then they were very clear about if you decide to stay in your home, you should put your name, address, and next of kin in a plastic bag in your pocket. So if we find your body, that we can notify the next of kin. I mean, I think they were trying to be as blunt as possible. So I want you to discuss these things. You're about 100 miles inland, so you're still going to see some storm surge. You're only barely over sea level, as much of Louisiana is down there in the Delta. And you know you're going to have widespread power outages and some flooding. Most of your population falls below the poverty level. So there's 4 questions I want you to think about when you're in your breakout groups, and I'll give you like 15 minutes to be able to talk in those. What factors do you take into consideration when you're selecting the location? Why would some members or residents not evacuate? Because if everybody left right, you wouldn't have to worry about finding emergency shelter. What health risks might the residents have if they stay in their home, both short-term and long-term? And what resources, and I kind of listed some of them, people, equipment, supplies, transportation, do you think you will need to open up an emergency shelter? Okay. All right. Any questions? Oh, I'll stop sharing. All right. Any questions on that?
I just wanted to let you know, because there's 3 of us, like we're just sharing a computer. So if you were gonna put in a breakout room, I don't know how many people you want in a breakout room.
Oh, thank you for telling me that, Lindsay. Okay. Well, I'm going to, I'll do it random. And if you find that you are in a breakout, well, actually, if you're 3 and you find you're just the 3, that would be fine, because they're going to be pretty small. And so I think it'll work out. But thank you for reminding me. Always remind me of that, because some of them will be different with different numbers. So great. Okay, and you all put your names in the attendance, right? In the
Oh,
chat.
I'll start right now. I actually forgot to do that.
Okay, so everybody remember to put your name in the chat so I know that you're here. All right, so I'm going to send you into breakout rooms. I'm going to give you 15 minutes, which will take us to just about 5 after. Class goes until 20 after, but I imagine we'll just do a quick debrief afterwards. I really want you just to experience what it's like to be able to have these conversations and actually just start thinking about what you have to notice when you are working with public health issues, when you're looking at a community and you're not just looking at one patient and what they actually need. You have to look at sometimes conflicting factors. So just have a good conversation. I'll bop in and out and see how you're doing and answer any questions.